Good morning, everyone. Thank you all for joining our Agents of Change training today. We're super excited to give you all some information over behavioral strategies for weight management in mental health settings. So, for you all joining, some of you all may be in the social work field, maybe LPCs or LMFTs. So, we're really giving this from a spectrum of the mental health field. Um, and weight management is a big topic for us to be very knowledgeable about, and we want to ensure that we have the right skills when our clients come to us. So I'm super excited today to have uh, Tanisha Martelli here to give us some more information on this topic for us to learn from. So before we get started, I'll go ahead and give you all some information about who you're seeing on your screen today. So my name is Bonnie. I am with Agents of Change, here to provide this training for you today. I do have a background in social work. I have my bachelor's and master's in social work, and we have worked with various populations. And no matter what population we work with, we can face some clients that are managing their weight or maybe some eating disorders. So, of course, we want to have this knowledge here. So, really excited for this topic today. And of course, our presenter here with us today has lots of great knowledge on our topic. Tanisha Martelli is a licensed master social worker. She's also a certified life coach, serving clients through telehealth, specifically within the Philadelphia region. She's worked with individuals across a lifespan in which these individuals are navigating anxiety, depression, stress, relationship concerns, parenting demands, caregiver burnout, educational career goals, life transitions, and weight management related concerns where we're here to learn about today. So we're really excited about learning about your collaborative approach and these practical approaches that you utilize in your practice, and also those reflective questioning, role play. I know we have some questions that I want to touch on as far as motivational interviewing and things like that. So really excited about this topic today to share with you all. Would you like to share some information about yourself?
Well, hello everyone. My name is Taisha, and like Bonnie said, I am a licensed social worker in the state of Pennsylvania, and I am also a certified life coach. Um, I could go on all day about my experience and different things that I have done. I pretty much think Bonnie addressed everything in a nutshell, so there's not really much for me to repeat, but yes, I have an extensive background in different avenues of social work. I've worked with different populations from early interventions to geriatrics. I currently am fully employed in healthcare. I have been working in healthcare for the past few years, and I have also begun to uh, work again in the early intervention realm. I did take a small hiatus, but I am back now. So that's me.
Awesome. Thank you so much for sharing that. And we're so excited to learn from it. The amazing thing about social work is that we can definitely move around from different populations that we serve. So I'm glad that you're taking use of that because it's so important for us to utilize that and put our skills in different fields as well. So thank you. With that being said, as well, so important for us who are joining in from different populations, serving different populations, or even settings. So, I want to share with you all why this topic is so important. Of course, again, with weight management or maybe eating disorders coming into the mix here, we're sharing this topic with you today because weight management is rarely about willpower alone. So we're wanting to address those additional things of mental health symptoms, stress, routines, beliefs, even relationships here, as well as medications, access to resources, and these responsibilities that can affect their health behaviors, which can make it really difficult to sustain. So we want to make sure that we're learning about these things and understand the topic on what we're learning today. As mental health professionals, we are in a very great position to address these things from an emotional standpoint, as well as behavioral factors surrounding our clients' goals. And these are conversations that we want to make sure that we're addressing because sometimes things that can come hand in hand with this is shame, coercion, practicing beyond our competence. So we're wanting to make sure that we're learning about this and taking that step further here. So utilizing this compassionate behavior focused approach can really help clients build confidence, develop sustainable routines, as well as pursue personality meaningful wellness goals here, while as well as preserving their dignity and their self-determination, which is part of our values and our ethics here as social workers. So, of course, I did want to put something in bold here on our screen. We see that the goal here is to really strengthen our clients' autonomy, their flexibility, as well as their coping skills and suitable health behavior when it comes to weight management. So we'll be talking about this today. And as you're joining us, you will be able to identify the emotional, cognitive, behavioral, relational, and environmental factors that can influence your client's ability to really mitigate any things that pertain to weight related wellness behaviors. You'll also be able to, leaving from this course, apply collaborative behavioral strategies, including value-based goal settings, self monitoring, problem solving, and even relapse planning to help your clients develop realistic, sustainable wellness routines. And again, as we leave this course, you'll also be able to differentiate the approach between behavioral health interventions, concerns requiring referrals to our doctors, registered dietitians, eating disorder specialists, and other qualified professionals that could be working within the team for your client. So, again, really excited to give you all this information today as we touch on this topic. So, as we get started here, um, before getting into some specific strategies here, can you share how your work with anxiety, stress, accountability really tune into weight management and kind of mesh together from time to time?
So, when dealing with a client who may be verbalizing that they are considering, restructuring themselves, looking to make a change. And oftentimes that change comes in the form of weight loss. It's very important to start with the why. Why are you looking to make this change? Now, the why can be very broad. Maybe this person has a family history that is predisposed to hypertension, diabetes, high cholesterol, cardiac issues. Um, or the why could also be just wanting to make an overall lifestyle change. So, depending on the reason for the why, is kind of like where the continuous of like the continuation of like the motivational interview comes in, where it's like, okay, let's say the person wants to do, the why is just a lifestyle change. Okay, what triggered this sudden onset of wanting the lifestyle change? And then we just kind of go from there and we pick apart the pieces. um Also, but as we are, in therapy dealing with someone who wants to essentially make a lifestyle change, we have to make sure that the why is aligning with, it has to be healthy. We want to make sure that the why is healthy. If a person wants to change how they look using weight loss, got to figure out the why. Why are we doing this now? This, especially if this has been a client that you have a rapport with, someone that you've been seeing for a long time, you kind of want to make sure that, something didn't happen that ultimately triggered this your client wanting to drastically change their overall look. And once you kind of get to the reasoning of the why, then it's essential as the therapist to kind of work with the patient to, I would say, set a realistic goal and just kind of help them develop a plan as to, well, what are you going to do to essentially reach your goal? And also to remember that as a therapist, you're not a nutritionist, you're not a dietitian, and to not overstep that boundary. And it's okay to suggest that, hey, maybe, here are your goals. This is what you want to do. I understand that. I respect that. And it's nice that you have a plan essentially and everything laid out. Have you considered speaking to a nutritionist to see if said goal is even realistic? Because we don't want to put you in a position to where you might end up causing more harm than you are good.
Most definitely. And this is definitely a hot topic for right now because there's a lot of um weight loss things kind of going around in this time. So what are some concerns that you notice come up very often that are red flags to those whys that the clients are sharing?
Unfortunately, the a lot of the majority of the red flags are people trying to emulate what they see on social media. Social media has literally thrown society into a downward spiral. Oftentimes, people see other individuals who they think are fitness influencers, but not knowing that this person achieved what it is that you might be considering perfection by doing very harmful things to their body. Whereas you might be thinking, oh, all they do is work out and they're on a calorie deficit diet. I can do that. But behind the scenes, they have had extensive plastic surgery. They're abusing GLP-1s and laxatives. And that is how they are achieving this facade that they're displaying on social media, to which, unfortunately, we have very vulnerable individuals who see that and say, oh, I want that. If this is what they're doing, I can get that. But the dark reality is how these people are actually achieving it.
Yeah, most definitely. And thank you for sharing that because it's so important for us to be aware of what our clients are facing outside of our sessions, looking at their phone, which is in our hand almost all the
Mhm.
time, right? Depending on who our clients are, but most of us tend to wake up to it, and go to bed with it, right? So definitely
Unfortunately.
building some skills around this. So thank you for sharing that. Um, and with this being said, what are some factors that therapists should assess before treating weight-related concerns as motivational or accountability problems?
So, like I had mentioned previously, the why factor, but also, you know, holding yourself accountable. Do you think this is realistic? Do you think that this would be something that you can achieve? And never, to discourage someone from, trying to become the more healthier version of them. But in something as serious as like weight management, it is important to take baby steps. Crawl before you walk, walk before you run. It's very unrealistic to have, let's say, a goal of, I want to lose 60 pounds in 2 months. Any medical professional will tell you that that is not realistic. And if there are some people who unfortunately, like I said, abuse GLP-1s, abuse laxatives, and things of that nature. You will end up doing more harm to your body than you are doing good.
Yeah, most definitely, because we want to ensure that our clients are getting the correct nutrition when it comes to our body as a whole and even as our mind, right? So thank you for sharing that. With this, you mentioned it being something that's a healthy goal. So, how can clinicians help clients move from this broad goal as um, this weight loss management or their why to an achievable weekly behavioral goal?
So, as a clinician, I would say again, asking the patient if they are open to speaking to a nutritionist, a dietitian. Um, Depending on what they say or their rationale as to yes or no, seeing what changes this person is willing to make. How many meals would you say you roughly eat per day? What is your intake like during that meal? Do you like snacks? Do you think that you'd be able to cut snacks out? So, starting by kind of like making minimal changes to see if this is something, that is even, feasible. And also, additionally, encouraging your client to, if they don't want to speak to a nutritionist or a dietitian, encouraging them to speak to a general practitioner like their primary also. Because again, as a therapist, I don't want to overstep and give advice in a realm that I am not privy to. Because again, I also do not want to cause more harm than I do good. But what I can do as a clinician is kind of see, okay, this is what you want to do. That's great. What small changes can we make? Because wanting to lose weight, wanting to discuss weight management, it's not like a one day, okay, I'm dropping everything, I'm going to train for a marathon. No, you have to start somewhere. And by starting somewhere is making those minimal changes, making those little changes. Okay, instead of eating 5 times a day, maybe I'll eat four. Instead of drinking 3 sodas, I'll only drink one, and I'll increase my water intake. So helping the client essentially reshape how they think and also some of the behaviors that they already have that are in place.
Yeah, thank you. Now, in this changing behaviorals and helping them with this plan, how is it that we can help with the emotional side to this, if that's something a factor for our clients?
So going back to the why, just constantly asking, what caused this? Again, it might not be due to previous family history. It getting to the why, and the why might not be, oh, I just want to be healthy. The why could stem from something emotional. So getting to the bottom of that why is essential to see, okay, what direction are we going to go in, and how are we going to navigate that? Essentially, weight management, in my opinion, it has to be for, like, you have to want to do that. No one can push that upon you. Now, in the why factor of, okay, I have a family history of diabetes, hypertension, cardiac issues. Okay, maybe I need to just kind of be on top of my weight, but not so much need to restructure my life, change everything. I need to lose 30 pounds. No. But if it's just totally out of the blue, yeah, I want to lose 80 pounds by the end of the year. Why? Where did this come from? Is everything okay? And if someone is telling you, yeah, no, everything's okay, but I saw this thing online where ah, let's dissect that. Let's talk about that.
Yeah. And if we're seeing this in our office, again, it's hot topic right now through social media. How is it that we can help our clients navigate that a little deeper within our sessions and staying within our scope?
How we can help our clients kind of navigate that is just kind of letting them know like everything, if majority, if not everything that you see on social media is not real. It's not. You know, these people are actors and they're trying to basically sell themselves to you. That's how they make their living. And by advertising these certain lifestyles and these changes and these things that they say, oh, I used to look like this, now I look like this because I work out and I drink matcha every day. And you know, that's not always the case. There's always a backstory. And oftentimes that backstory is not a healthy one. So here you are trying to chase this dream that this person is selling, but lo and behold, it's been false advertisement this whole time.
Yeah, most definitely. And what are some frameworks that you notice are really beneficial that you'd like to share with anyone tuning in today that would be beneficial to utilize with our clients?
I am a big proponent of solution focused therapy. I've always loved utilizing solution focused therapy, but also cognitive behavioral therapy. I mean, absolutely. Like getting to the why, the getting to the once you get to the why, it's pretty much, you know, going to give you the tools that you need to navigate the situation. But also solution focused is you're basically helping give your client the tools to kind of work out the why themselves. I mean, you're still there along the way, holding their hand, working things out with them, but you're essentially giving them the keys to drive the car.
Yeah. And what do those next steps look like, whether it be solution focused or the other route that you're taking with your framework that you're suggesting for us today?
So once we get the why, let's set up some goals. Let's set up some goals. What changes and what changes and what actions are we going to take? Are you going to reach out to a nutritionist or your primary? And if yes, is the goal that you have set for yourself, is it realistic? Is it healthy in the long run? And what changes are you willing to make to achieve the goal that you're looking to achieve?
Thank you. And once this connection is made, if they're able to confirm that they are working with a nutritionist or some other important professionals, how do you navigate some, collaboration there for your clients?
Okay. So, you know, since working with a physician, since working with a nutritionist, how are you feeling? Do you see a difference? Do you feel like I would say the slower, more monitored approach that you are taking, how do you feel like it is? Do you feel like it is making a difference in the goal that you are trying to achieve? Because weight management, weight loss, it's not an overnight fix. You have to work to reach the goal that you want. So definitely constantly checking in, seeing where the person is at and seeing how what it is that they've been working on with, you know, whether it's a primary care physician, whether it's a nutritionist or dietitian, just seeing how what they have put in place, how it is aligning with the goals that you as the therapist have put in place with your client, and seeing if we are ultimately reaching the goal that the client has set for themselves.
Yeah, thank you. And in this process, sometimes we can utilize motivational interviewing to support weight-related behavioral. So, what is some of this look like without the clinician becoming um, controlling in this part of motivational interviewing?
So, without the clinician becoming controlling, when the topic of weight management or weight loss comes up, I think the wording and how you ask your questions is essential. Because when someone brings up weight management, weight loss, it's, in my opinion, and from what I've seen, it's because that the person thinks that there is a problem. So in motivational interviewing and in the wording of and in how you word your questions, it's kind of like, well, when did this become a problem for you? Or why did this become a problem for you? Or has this been a problem? Or is there something that you're concerned about? Because again, remember that why can stem from a family history of diabetes, hypertension, cholesterol, medical issues that this person might think, hey, I'm getting older. I need to be on the lookout for certain things.
When it comes to working with our clients,
Mm-hmm.
what are some questions that we can help our client explore ambivalence when it comes to weight management?
Now, would this be prior to like when the conversation like essentially starts, or like is the client already into the process? Like, where are they when we're like trying to?
Yeah, we can address it in any way because we want to give our audience like this knowledge on when this comes up. So, however you'd like to answer that.
When it comes to ambivalence in weight loss, I mean weight man I keep saying weight loss, weight management, I guess like questions I could use is just, it would have to be like for me, it would be like the check-in questions to just kind of see like, how are we feeling with how things are going? Because just because, we have this plan put in place and we're doing all these things to essentially lose weight or better manage our weight doesn't mean that we might be getting the results that we anticipated. So definitely just checking in with the patient to ensure that they are doing okay regardless of the results that they might be getting, because they might not be getting any results, and they might not get any results for a very long time. So just basically making sure that they're still okay regardless of lack of results or results that they're getting, just kind of just making sure that they're overall okay.
Yeah, most definitely. Something important for us to consider here. And sometimes our practices look really differently as far as the time that we have with our clients.
Mm-hmm.
So, how can self-monitoring be used as a tool for curiosity rather than surveillance or like really strict monitoring? Because that can be a tricky thing with weight management.
So, in regards to like self monitoring, I often encourage a lot of my clients to journal. And if like a formal journal isn't really their thing, typing notes into your phone, just checking in with yourself, seeing how you're feeling. How's everything? Like, how am I? Because, depending on um, your schedule with your client, you might see this person weekly, bi-weekly, or monthly. So essentially encouraging your client to often check in with themselves is very essential in, I believe, in the process of any type of change, whether it's, weight management, uh, transitioning to a new position at work, transitioning to a new job, transitioning in and out of a relationship, just constantly like encouraging your client to check in with themselves is important.
Yeah, thank you for sharing that. With this being something that could be tricky when it comes to weight management, what are some things to consider to discontinue monitoring to assess for a higher level of concern?
I would say in the with the subject of weight management, obsessively checking one's weight is definitely something that can cause, other psychological and behavioral issues, anxiety, depression, stress, which can trickle into things like OCD because you will become obsessed with the numbers on the scale and whether they're moving or not. So you don't want to that's one behavior that it's you kind of have to, make sure that you you don't want to obsess over that pretty much.
Yeah. Now sometimes clients can, of course, have hiccups. We're human beings and things happen. And so this can be interrupted, whether it be a missed workout, a difficult meal, even a stressful work week. How is it that we can help navigate our clients in this all or nothing thinking when it comes to health goals or weight management?
I mean, being responsible enough to hold yourself accountable. Everybody has hiccups. I myself am guilty of hiccups. Holding yourself accountable, but also being kind to yourself. You don't have to beat yourself up, but definitely holding yourself accountable is important. Is important. It's okay. One skipped workout, maybe two, and a cheat meal here or there, but hold yourself accountable.
And if we see a client like this coming into our office, what are some things that you see the session look like or being things that we're addressing here?
So oftentimes, when issues do arise in sessions, the sessions typically are what I've come to realize is unfortunately, it's often a lot of negative self talk, the client, being guilty, beating themselves up for what they did. And as the clinician is just reassuring the client, it's okay. It's it's okay. You are entitled to not want to work out one day. You are entitled to that slice of pizza if you want that slice of pizza. It is not the end of the world and it is not going to ruin your goal. It's okay. Letting them know that hiccups are okay, but also, again, holding them accountable, but still letting them know it's okay. You did not break anything. We're just going to pick up where we left off and continue.
Yeah, well, thank you for sharing that because it's something insightful to just be aware of sometimes to
Mhm.
prepare for our clients there. So, what are some other tools that you see are super beneficial or something that you're always leaning towards with your clients in weight management?
When navigating something as tricky as weight management, it's really important to just let them know that you're there and to give them that support because oftentimes when it comes to a patient who is looking to, do weight management, weight loss, unfortunately their why is not pertaining to, past family medical history. It's pertaining to, what they see on social media or someone who they may have romantic feelings for but does not like them or the feeling is not mutual, unfortunately due to how they appear. So, it ties hand in hand, unfortunately, a lot with anxiety and depression. So just letting them know that you are there for them, I feel like is one of the most important things that you can do with someone who is struggling with weight management because so much is tied into it's not just weight management. You're dealing with other pre-existing conditions like anxiety and depression, and then the some other, unfortunately they might develop some compulsive disorders as well. So just letting them know that you are that support and that you're in their corner is the most important thing.
Yeah. And we talked about how your specialty is in anxiety, depression, stress, and even relationships. And you mentioned that's something that comes up for your clients. So how and when do you navigate, okay, yes, weight management is a thing. They're seeing a nutrition or they're seeing someone else and focus in your sessions on, what is deep down here.
Mhm. So overall, I feel like when it comes to weight management, weight loss, that has to be something that the individual wants to do for them. This cannot be something that we are allowing outside noise to force upon us. And unfortunately, 9 times out of 10, that is the case. And to have someone who's already dealing with anxiety and someone who's already dealing with depression, that's a lot in itself. But then to throw in, the weight management and weight loss, it's a heavy burden to carry. But I feel like addressing the anxiety or the depression, I personally feel like, that's primary in my opinion. That has to be primary. And then but also incorporating, okay, weight loss, weight management. We're doing, we're incorporating everything together, but I feel like we have to start at the surface, which is, typically the mental disorders of, anxiety and depression.
Yeah, and staying within our scope at all
Definitely
times.
staying within our scope.
Yeah. So, what are some ethical dilemmas you see or encounter where you're like, okay, we got to put a line or a boundary here from time to time?
I mean, oftentimes, unfortunately, like some clients come to you and they think you're like a one-stop shop. And, I will tell a client, or, I subcontract for some companies and they're like, oh, this patient has this issue. I will let them know in a heartbeat, I can't tackle that. That is not my specialty. Or I've never done that before. I can't. So as the clinician, you need to be self-aware also as to what you can and cannot do. I am not shy in telling anyone, yeah, I'm not too familiar with that topic. I don't think I can help you, but let me assist you in getting to someone who can. Now, again, with issues such as weight management and things like that, I do believe that yes, we can tackle the psychological aspect as to, okay, why does this person want to do a complete 360 on how they look? What's going on with that? But when it comes into, the meat and potatoes, let's say, okay, they want to cut meals, they want to work out. Okay, I think this is where we need to get an outside entity in, such as a nutritionist, to see if you're healthy enough for this. If, the goal you're setting in regards to body weight is ideal for your height and any other medical issues that you already have in place. So definitely being a being a clinician is one thing, being a self-aware clinician is another thing. And as a clinician, it is okay to say that's not my scope, or I don't know, but please let me help you in finding someone who can.
Yeah, and we want to make sure that we're taking accountability for our scope and specialties. So definitely be aware. Just like this might come into practice with culture, not being aware of something a little bit different. This goes hand in hand with weight management. So thank you for sharing on that. Um, Now, with this as well, sometimes we can encounter some things when it comes to supporting health-related behaviors without implying that weight determines a person's worth, their discipline, or success. So how can we help our clients in these areas?
I think how we can help our clients kind of break that down is once we discover, again, I'm sorry, I keep going back to the why. Once we discover the why, we kind of have to, pick apart from there and get to the real reason. Granted, some clients will let you know, no, I just want to lose weight. Okay, cool. But if this has been a long-standing client, someone who you've worked with for a long time, and depending on what pre-existing condition that they were already seeing you for, you can kind of figure out why this might have become a topic now during your session or why we are now working towards this. And then we go from there.
And in this too, how can we help with relapse planning when it comes to weight management?
How we can help with relapse planning when it comes to weight management is continuing to show our unwavered support to our client, no matter what. Allowing our client to know that this is a safe space, it is a judgment free zone, and relapses may not be ideal, but they do happen. And helping to kind of come up with a plan as to, okay, so what are we going to do next time so that this doesn't happen? What are we going to come up with? Because we're a team. So what are we going to come up with to ensure that this doesn't happen?
That's definitely, thank you. I know there's a little bit of a hot topic right now on whether it be a virtual session or session in person. And I've been asking our presenters here, but what are your thoughts on eating or drinking during a session, especially when it comes to weight management and our clients in our office?
Oh, now eating or drinking. So virtual majority of my clients have been virtual. And I can say that I have never, with the exception of a bottle of water, no one has eaten or drank anything during a session. Um, Now in person in an office space, I mean, I would say snack would be a light snack, cup of coffee, water would be it would be okay. Um, but in regards to, seeing a client for weight management, I'm from Philadelphia. So if a patient who I'm seeing for, let's say, depression and anxiety and weight management, if they were to pull a cheesesteak out of their bag, I may, kind of inquire as to, do we feel like that is the best option of a meal, especially for the goal that we currently have in place for weight management? What other options did we have as opposed to a sandwich?
Yeah. And how about us as clinicians as well? Of course, we need to practice self-care and nutrition, and
Mhm.
sometimes that's not the best thing. We don't even take lunch breaks for some of us listening here. So, what are your thoughts and perspectives on that as well from the clinician side?
From a clinician side, I have been guilty. Unfortunately, I have been guilty of, not taking breaks and this is during my workday. And unfortunately, things like that catch up with you to where I have gotten physically sick, both at home and at work. So I make it a point now. I am taking my lunch break. I am taking my mid morning break. And that is a non negotiable. And if I feel too overwhelmed or too flustered, and you can determine that for yourself, you know, the phone's ringing, your boss is calling you, everything's happening all at once, feel free to get up and step outside. I work in a medical clinic setting. So it's not, it's literally you hit the ground running. As soon as I walk through the door, I hit the ground running. But I am very self aware to the point where if I'm getting overwhelmed, I know. And I do not have a problem taking my phone and my AirPods and stepping outside, whether it is for 5 minutes or 20 minutes. I am going to separate myself because I cannot be the best version of myself. And that means me, Taisha, as an employee, I cannot be the best version of myself if I'm overwhelmed. So it is very important as a clinician, and especially in this type of work that we do. And you know, we preach this, but a lot of us, and I'm guilty of this myself, do not practice this. Self-care is a must. It's a must. That should be a non-negotiable. That should be a non-negotiable. You have to take care of yourself because burnout is real. It's scary, and depending on how you handle things, it burnout from one incident can last a couple of days. And that affects you physically, not only just mentally and emotionally, it affects you physically. So take your breaks and take as much time as you need during the day.
Thank you for that. So important for us to be aware of what we're needing. Again, as you mentioned, to show up as, your highest percentage. I don't want to say 100% because sometimes
Mhm.
that can be difficult, but just as you mentioned, to be able to show up as the best employee that you can and for
Mhm.
your clients as well. So thank you for that. And just being really considerate of this, of who you have scheduled for the day, who you're seeing. Yes, we might not be able to eat or drink in session, but we're taking that lunch break, we're taking that
Mhm.
early break, or even that 3 p.m. slump that we're feeling
Mhm.
sometimes. So thank you. Now, with this, for anyone who is joining us today and feeling a little bit afraid or just nervous to work with these clients, what do you hope that clinicians can kind of gain from this and take as a next step to work with these clients if that's something that they're interested in?
I mean, as a clinician looking to work with these clients, it's okay to not know everything. It is okay. It's okay. Do not beat yourself up. We're always learning, and it's okay to continue to learn. And if you don't know something, read up on it. It's fine. That doesn't mean that you're a bad clinician. It doesn't mean that you're a bad therapist. It just means that, hey, I've never had to cross this bridge. Let's learn together. It's okay. Be okay with not knowing everything.
Yeah, thank you. And I just want to thank you so much for giving us this great information on weight management. It can be a topic that we tend to avoid or feel a little bit nervous about if it's outside of our scope. But hopefully, you all were able to take some really great things from today and, of course, notice what the importance is here for our clients. The goal, again, is to strengthen their autonomy, their flexibility, coping strategies, and even ensure that they have sustainable health behavior, and ensuring that we're working within our scope. So, thank you so much for all of your information today and giving this to us.
Thank you for having me.
I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or click the link in the description to purchase the course and earn your CE certificate. If you're looking for more CEs, check out our unlimited plan. You get unlimited access to more than 200 ASWB and NBCC approved continuing education courses and more than 20 live events each year for one low annual fee. We're always adding new and exciting courses. Check it out at agentsofchangetraining.com.